Now we are continuing our webinar as English. Now it is the beginning of the English session. As usual, we will start with a silent prayer. Good evening and welcome once again. And today is our 1448th day, 84th day of continuous webinar. Thank you all the participants, faculties for joining with us and for sharing the knowledge and to become now IFPH become a big family. Thank you for everything. And today's our guest is Dr. Shweta Singh. She is MD in homeopathy and she's a PhD holder and working as a Central Research Fellow in Central Council of Homeopathy Research and working in headquarters New Delhi. And she's a senior consultant in Orbit Clinics and she has more than 10 years of experience and she's expertise in treating many difficult cases. And I'm welcoming Dr. Shweta Singh to IFPH webinar. Dr. Shweta, you are welcome. Are you joined? Dr. Shweta. You're welcome, please.
Thank you so much, Dr. Anjali, and I would definitely thank Dr. Danish, Dr. M.K. Sani, sir, for giving me this opportunity to share my small experience about uterine fibroids and homeopathy to all of you. Shall I share my screen? So today's my topic of presentation is the evidence-based homeopathy in uterine fibroids. So let's see a brief what is uterine fibroid. So it is basically the benign monoclonal tumor of the uterine smooth muscle cells and consists of large amounts of extracellular matrix that contain collagen, fibronectin, and proteoglycan. There are various synonyms of uterine fibroids, and they are myomas. We can call them as myomas, leiomyomas, and fibromyomas. It is basically the commonest benign uterine tumor, typically found in during the middle and later reproductive years, because they are mainly influenced by the sex hormones like estrogen, progesterone, and androgens. They rarely appear before menarche because totally dependent on estrogen. So they rarely appears before menarche and they regress after menopause. Globally, around 235 million women are affected with uterine fibroids. We can say 6.6% of females, and about 20 to 40% of females will be diagnosed with fibroids at some or the other point of their life, but only a fraction of females they require treatment, and there is the fibroids cause problems in them. So the main idea is they are mostly benign. They usually appears after menarche, and they can cause problems during the reproductive years, and they are useless after mostly useless after menopause. They won't cause any problems in menopausal women. Now, if you talk about the risk factors, so if you found any, they can be positive family history. Black women are more likely to have uterine fibroids than the whites because the estrogen production is more in Black women. Obesity, basically there is increased production of androgens, estrogen in the obese women, so they are more likely to have fibroids. Then early menarche and nulliparity, low parity, or oral contraceptives are the risk factors for developing fibroids, for influencing fibroids. The irregular use of contraceptives basically increase the risk of fibroids in women. So high dose pills have been associated with stimulation of fibroid tumors. So these are basically the risk factors to develop or to influence the growth of uterine fibroids. Then if we talk about the classification, basically they are classified on the basis of their location. 99% of the fibroids are uterine and 1% can be extrauterine. In uterine fibroids, they can be 95% are corporeal and 4% there are chances to have cervical fibroids. In the corporeal 95% fibroids, the most common fibroids are the interstitial fibroids. 60% fibroids are interstitial. 20% are submucosal and 15% are subserous. Then 4% cervical. Extrauterine may genital fibroids you can see, and there are extragenital, parasitic fibroids, and others can be there. Then the classification, according to the location, I said they are classified. So the intramural fibroids, they are the most common types. 60% fibroids are intramural fibroid, or you can say interstitial fibroid. They are located within the wall of the uterus. And unless large, they may be asymptomatic. We have already discussed that 20 to 40% females do not produce any symptoms because of the fibroid. So they can be intramural fibroids. Unless they are large, they may be asymptomatic, and they can be begin as a small nodules in the muscular wall of the uterus, and with time they may expand depending upon the production of the hormones estrogen. They may expand inwards, and if they become large, they can cause distortion or elongation of the uterine cavity, which may directly affect the bleeding or the symptomatology in the female. Then the subserosal fibroids. Basically, the subserosal fibroids are located underneath the peritoneal surface of the uterus. They can become very large, and if subserosal fibroids, they have the pressure symptoms. They are presenting outside the layer, outside the uterus. So they may have pressure symptoms over the bladder, over the rectum. So they can cause if they are presented over the frontal area, then they can cause pressure on bladder, and which can cause urinary symptoms. If they are presented over the posterior surface, then they may bulge over from the back of the uterus, and they occasionally press the rectum, which can cause constipation, and it can also press over the spinal nerves, over the pelvic nerves, which can also cause backache. So they can also grow out in a papillary manner to become pedunculated fibroids, and these pedunculated fibroids can detach over the time from the uterus to become a parasitic leiomyoma, which can be present over anywhere in the body. Then the submucosal fibroids. Submucosal fibroids, they are located in the muscle beneath the endometrium of the uterus. They are the most risky ones, and they are the primary cause of the prolonged heavy menstrual bleeding during in the patients of uterine fibroids. Because of their presence, they distort the uterine cavity. A pedunculated lesion within the cavity is termed as an intracavity fibroid, and it can also, if large, it can be passed through the cervix. Then the cervical fibroids, they are located in the wall of cervix at the neck of the uterus. Rarely, the fibroids are found in the supporting structures like round ligament, broad ligaments, or uterosacral ligaments of the uterus that also contain smooth muscle tissues. So basically, they are wherever it can present itself where the smooth muscles are present, tissue are present in the uterine cavity or outside of it. This is basically the picture which shows the presentation of fibroids subserosal at the outer exterior of the uterus, submucosal you can see at the just beneath the endometrium, and intramural between the layers of the uterus. As we have already discussed, 50 to 70% females with the uterine fibroids, if they are small nodules, they may be asymptomatic, and 20 to 50% may experience symptoms like menstrual dysfunction. There can be bowel or bladder dysfunction, uh, bulk effects or pressure effects can be there, and there can be pain in lower abdomen because of the presence of fibroids. The symptoms could be vaginal bleeding, which is the commonest symptom of the presence of uterine fibroids. Bleeding can be, there can be menorrhagia, polymenorrhea, which is most common, and it can be because of the associated hormonal imbalance or the endometrial hyperplasia because of the large size of the your fibroid. There can be surface ulceration of some mucous fibroid. The interstitial fibroids, they act as a foreign body. They can prevent the contraction of the myometrium to decrease the blood loss. They can be the menorrhagia or polymenorrhea can be because of the pelvic congestion. And it can be because of the increased uterine size, because of the increased vascularity, or because of the increased endometrial surface area because of the presence of fibroid. They can be metrorrhagia, and it can be because of the associated endometrial polyp or associated malignancy. It can be because of the submucous fibroid. It may have ulceration of the surface. They can be necrosis, and there can be secondary infection. And there could be contact bleeding, and there could be pain during intercourse or dyspareunia you can see in fibroid patient. There could be post-menopausal bleeding just because of the sarcomatous change or associated endometrial carcinoma. You can see discharge. The patient can complain of vaginal discharge. That could be because of the presence of uterine fibroids, and discharge could be because of the pelvic congestion caused by the presence of fibroid. The discharge could be mucosanguineous, or it could be mucopurulent due to the presence of secondary infection. The patient can also complain of swelling, either abdominal swelling due to presence of large fibroid, or there could be vaginal swelling due to the presence of associated endometrial polyp. In 5 to 10% cases, the patient can also complain of infertility. The most important is the underlying predisposing factor, such as an ovulation or the hormonal disturbance. The broad ligamentary fibroid, it may stretch or distort the tubes, so it can affect or interfere with the fertilization. The corneal fibroids, they may obstruct the uterine end of the tube, so it can obstruct the normal fertilization process. The submucosal fibroid, they can also interfere with the implantation. Cervical fibroid can obstruct the cervical canal, and the associated endometriosis or the endometrial hyperplasia, all of these can affect the implantation or the normal fertility process. So it can cause infertility in such patients. Pain is usually uncommon, but it can be there because of the presence of some mucous fibroid, and the patient can feel intermittent colicky pain. They can be spasmodic or congestive dysmenorrhea due to the presence of pelvic congestion. Dyspareunia can be there, and in complication of fibroids, like in red degeneration, or if the fibroid got torsion, or there is ruptured vessel or inflammation, there can be acute abdominal pain. The pressure symptoms, if there is presence of cervical fibroid anteriorly, it can cause, it can press over the urinary bladder and it can cause acute retention of urine, or it can cause increased frequency of micturition because of the its presence. Then laterally, it can also have pressure effects on the ureters and it can cause colic, renal colic, and back pressure on the kidneys. Posteriorly, over the rectum, it can cause constipation and there can be a sense of incomplete defecation in fibroid patients. Sometimes our fibroid patients can only complain of gastric issues, distension of abdomen, and such such symptoms of constipation, incomplete defecation, and you can advise them to, if they are of that reproductive years, middle-aged female, you can advise them to go for ultrasound, and there is possibility that they may have uterine fibroids, and these symptoms are just because of those the presence of fibroids in them. And if the fibroid is very huge, if it is the size is very large, then it can also have pressure effects over the pelvic veins and it can cause edema, pain, varicose veins in the lower limbs. On the GIT, it can cause distension and dyspepsia. Because of the presence of huge fibroid, there are chances of dyspnea in such patients. So such gastric symptoms, such varicose veins or varicosities or pelvic veins can be affected because of the presence of uterine fibroids. So we must take care of that in our females in the middle-aged group. Then the effects of fibroids on pregnancy, it can cause infertility, it can be the cause of abortion, there can be premature uterine contractions in such females, there can be preterm labor, abruptio placenta, abnormal lie and position, it can interfere with the position of the fetus, and there can be increased rate of operative deliveries in such patients, and it can also cause postpartum hemorrhage in such patients. You can also check for anemia in uterine fibroid patient because of the heavy bleeding they may encounter due to its presence. You can also in abdominal exam, during abdominal examination, you can also find large pelvic abdominal swelling in case of huge fibroids. In the pelvic examination, you can see symmetrical or asymmetrical enlarged uterus, and in speculum examination, you can also find out the fibroid polyp. Now the complication, it may cause red degeneration, it may cause torsion, which can cause acute abdominal pain, and which may be acute emergency which can cause acute emergency condition. There can be prolapse of submucous fibroid, ureteric obstruction can be there, and there can be venous thromboembolism if we just ignore the symptoms. Intestinal obstruction it may cause, and there can be malignant transformation, but it is rare. In 1% cases, these benign monoclonal tumors can turn into malignancy. Then for the diagnosis, we can go for bimanual pelvic examination. We can palpate the abdomen and the uterus area for an enlarged form irregular uterus. We can go for pelvic ultrasound, and for better view, we can go for transvaginal sonography in case of married female. We can also go for transrectal sonography, and we can also advise for CT scan or MRI for proper diagnosis. We can also go for routine investigations to differentiate and to diagnose the proper condition, and we can go for complete blood count to check for anemia, and other iron studies we can advise for finding out the total iron binding capacity and for ferritin levels. We can go for hormonal assay, and we can go for FSH, TSH, prolactin, progesterone, thyroid functional test. We can also advise for LFT, KFT to the patient, and we can also advise for pregnancy test in such patients. Now for the treatment plan, we should have an integrative approach towards such patients, and along with the homeopathic medicines, we should also advise the patient regarding their diet, regarding their physical activities or exercises, and we should also counsel the patient. This is our responsibility. So the approach should be integrative. As we all know, homeopathy, basically the homeopathic medicines treat the patient as a whole, not only the disease, and removal of the disturbing organs by the surgical means, it forbids the expression of vital force. So by surgical surgeries, we can only forbid the expression of vital force, but we cannot cure. The cutting off the manifestation of disease, it won't prevent the further disease manifestations, and it can only worsen the patient condition. Such conditions are the expression, the uterine fibroids basically, and any of the gynecological problems from which the patient is suffering are the expression of the inward turmoil and distress under which the whole individual suffers. So our aim should be to treat the patient as a whole, not the organ, not the disease. And constitutional treatment or the anti-miasmatic treatment is the best treatment in such cases. In aphorism 94 footnote, our Dr. Henneman mention the proper how we should take the female case taking. He already mentioned it, that in chronic diseases of females, it is especially necessary to pay attention to the state of pregnancy, to sterility, to the sexual desires of the females, to the accouchments or the lactation period or the miscarriages if she has any, and the state of the menstrual discharge. So we have to take proper history of the female regarding all the stages of her past life. Then with respect to the last named, particularly regarding the menstrual discharge, Dr. Henneman asked us to not neglect the menstrual discharge, things related to menstrual discharge, if it recurs at too short intervals or if it is delayed beyond the proper time. So we have to ask our patient regarding the same, and how many days the menstrual discharges last, whether the flow is continuous or it is interrupted, what is its general quality, what is its color, whether it is dark in color, whether it is bright red in color, whether it is blackish or dark brown, what is the color of the menstrual discharge, how it smells, what is its consistency. We have to ask all about it. Whether there is any vaginal discharge associated before the appearance of menstrual flow or after its termination, and what are the bodily, the physical or the mental ailments are associated with the menstrual cycle, what are the sensations, what are the pains, if it is there, if it is preceded, accompanied or followed, if there is leukorrhea, if there is any kind of vaginal discharge, what is its nature, when it occurs, in what conditions, in what occasions it occurs, and what are the sensation attends its flow, in what quantity it is appearing. So we have to take note of all these this history in a female while treating her for any of the disease, not only in uterine fibroid but in any gynecological disease. We have to check with the patient about this history. Then menstrual history, what is its menarche, what is when the its last menstrual period was there, what is the cycle and duration of the menses, what is the character of menstrual flow, and what are the associated complaints before, during, and after the menses. Associated complaints with the menstrual flow, what are the physical complaints, if she has any dysmenorrhea, any backache, any mental ailments, if she feels irritable during menses, if she feels VP, what is her mental state before, during, and after menses, what sensations and what pains are associated before, during, and after menses. We have to take note of all these things. Then the vaginal discharge, if it is appearing before or after menses, what is its quantity? What is this character of discharge? If it is white in color, if it is egg white, if it is transparent, if it is yellow, or if it is bloody, what is the character? What is its consistency? If it is thick, thin, watery, how is it? And the type of sensation attended with the vaginal discharge. What are the modalities? What are the conditions? What are the occasions under which it appears? So we have to take note of all these things in a female patient. Then why it is necessary to ask so much regarding our female patient? Because through this we can differentiate our remedies, we can reach to that simillimum which is required for a proper treatment or for a speedily recovery in our patient, because we have such medicines which we can differentiate according to the color of the menstrual discharge, according to the color of the leucorial discharge, and at what time they are appearing, in what position they are appearing. So we can differentiate our remedies according to that. If it is if the menstrual flow is painful, then we have a lot of remedies, and if it is painless, we have some remedies. If it is clotted, if it is not clotted, so we have such differentiation in our materia medica. So we should consider all these symptoms to get our simillimum to have a proper treatment of our patient. Then I want to discuss one case of mine, an obese female, 45 years of age. She was a housewife, consulted me in December 2023. This is her report, and she was a diagnosed patient of uterine fibroid since 3 months, and there was a presence of subserosal fibroid of approximate size 25.2 into 19.2 mm, which is seen in the interior myometrium. So this is her report, and the presenting complaints were menorrhagia since 3 to 4 months. The character of flow was profuse, dark red with clots, and LMP was in November 23, and there was accompanying symptoms. There was heaviness on both the breast, which is mainly aggravated before menses. There was also presence of back pain, which is aggravated by motion. The patient also had cervical spondylosis since many years, and she was also complaining of pain at the nape of neck and back with vertigo. She was anemic due to this heavy bleeding, and her HB levels were 10.5 gram per DL. She was also diabetic, but for that she was on allopathic treatment. In the general symptoms, the thirst was normal. There was desire for salty things, chicken, cold drinks, tea, and there was intolerance for spicy food, which leads to burning. and there was aversion to sweets. Stool was occasionally hard, and the patient was hot. Tongue was spotted white. Mental generals, the patient was very irritable with anger, but there was suppression of anger. She didn't show her anger to others. She's like, she weeps when alone, and she is aggravated by consolation and contradiction. So on repertorization, with the totality, that I formed was menses profuse dark, heaviness of chest before menses, irritability with anger, weeping disposition, desire for salt things, tea, cold drinks, aversion to sweets, anemic patient after hemorrhage, tongue white coated, and the patient is hot. So on repertorization, we got calcarea, phosphorus, sulfur, natramure, arsenic at the highest as the highest grade remedies. But repertorization is basically a mechanical process, and we have to consult materia medica to reach to that simillimum which our patient requires, and which is more similar to the picture of our patient. So basically, if we talk about calcarea, the calcarea patients are very lazy. They have aversion to work or exertion, but our patient is not like that. She's very active, and though she was chubby, she was fatty, and but she was not chilly. The patient was hot, but the calcarea patient are chilly patient, and there is a core feeling of insecurity in calcarea patient, which was not there in my patient. So I just turn to the other remedy, phosphorus. Phosphorus patients are very extrovert, but my patient was not that extrovert. She was little reserved, introvert kind of patient. She was not that oversensitive like phosphorus. She was not that expressive like phosphorus. Though she desires for salt and cold things, but the patient was not chilly. The patient was hot. So she was not tall, cylinder, or lean thin like phosphorus. There was no such restlessness like in phosphorus patient. So I also exclude this remedy. Then the next remedy was sulfur. Sulfur patients are basically they are hot patient, but they, instead of salt, they desire sweets. And our patient was not that dirty, filthy like sulfur. There is no such skin problems, and sulfur patients are more prone to skin diseases. There was no such past history, uh, or at present she didn't have such problems. The patient doesn't have that aversion to bathing. She likes to bath. There was no such burning that is present in sulfur patient. There was no such dryness of skin or hairs. The patient was irritable, but there was suppressed anger. There was no such morning diarrhea, or which the patient uh, goes out of bed. Such symptoms were not there in our patient, so I excluded this remedy. And then natramure. Natramure, the patient was hot. Natramure is a wonderful remedy for anemic patient. There was suppressed anger with irritability, and the patient desires for salt things. So many of the symptoms they match with my patient. So I prescribed her natramure 200 single dose, followed by auramure natronetam 3x, one tablet 3 times a day for the next 10 days. In the next follow, the flow was reduced and not that much profuse like before. There was heaviness in breast, which was much better this time, and back pain was much relieved, and irritability was also reduced. So I prescribed Rubrammet 200 single dose, followed by Auramune Natronetam 3x, one tablet 3 times a day for the next 10 days. And the next follow-up, in the next month, the patient was feeling much better, and there was no profuse menses. The menses were very fine. She is better generally. Back pain was much relieved. So in the next month, I prescribed again one dose of Natramu 200 and continued the same Auramune Natronetam 3x, one tablet 3 times a day for the next 10 days. In the next month, the menses were regular. They were not copious in nature. Patient was feeling much better, and back pain was also much relieved. So in the next month also, I prescribed Natramune 200 single dose, followed by Auramune Natronetam 3x, one tablet 3 times a day for the next 10 days. And after this 3 months, I advised her to go for transvaginal sonography. And this is her report, which was very much fine. There was no presence of any fibroid in the report. And you can also listen to our patient.
जिसके कारण मुझे 2 महीने आया नहीं, उसके बाद एकदम से तो 1 महीने तक लगातार पीरियड आता रहा, जिसके कारण फिर मैंने डॉक्टर ने दिखाया, गायनी को दिखाया, तो मुझे बोला कि आप एक अल्ट्रासाउंड कराइए। अल्ट्रासाउंड जब मैंने कराया तो उसमें रसोई की शिकायत हो रही, तो उसके थोड़े दिन बाद उन्होंने बोला कि अब आपको ऑपरेशन कराना है। इसके कारण मैं थोड़ा डर गई। फिर मैं थोड़ा रुक के मैं थोड़ा इधर पूछी लोगों से, तो किसी ने मेरा एक तो उन्होंने मुझे डॉक्टर श्वेता के बारे में बताया, तो होम्योपैथिक की बहुत अच्छे डॉक्टर है, अगर आप उससे कंसल्ट करोगे तो वो आपको अच्छा इलाज बताएंगे। तब मैं उनके पास गई, तो उन्होंने मुझे दवाई वगैरह दी। अच्छा से 3 महीने के बाद फिर उन्होंने मेरा एक और फिर अल्ट्रासाउंड कराया, जिसमें मेरा रसोई की शिकायत बिल्कुल भी नहीं, और मुझे बहुत अच्छा रिलीफ मिला, जिससे मैं आराम से मेरा ठीक हो गया। मैं बहुत अच्छा फील कर रही हूँ, मतलब कष्ट नहीं हुआ।
Now moving towards the next case. This is a case of an obese woman of fair complexion, aged 33 years, who came to me with her ultrasound report, which said that she had intramural fibroid in the posterior wall. On inquiry, she also complained of excessive bleeding during menses for the last 6 months. In the gynecological obstetric history, the menarche was on time at 15 years of age. Menses were early, dark red, profuse bleeding with clots. It was very much clotted, and there was a number of issues were 4, 2 male and 2 female child. All were the cesarean deliveries. There was a history of miscarriage, and one DNC was done 6 months ago. Past history, she was a diabetic patient since 4 years, for which she was taking allopathic treatment. There was nothing significant in the family history. She was happily married at the very young age. In the physical generals, the desires, aversions were not so significant. There was nothing significant, and appetite was good. Thirst was for large quantity drinks often, and sleep was fine. Thermal reaction, she was a chilly patient. The significant history which I found in this case was about the DNC, which was 6 months ago she undergone, and it was very much painful. So with that pain, I got the idea about the instrumental injury, and on the basis of this history, I prescribed Arnica 3x to her for 1 month, followed by, in between, I also gave Hypericum 1m as an intercurrent remedy. So you can match her reports. There was a intramural fibroid in posterior wall that was of 12 into 13 mm. And in the next ultrasound, you can see there was no such fibroid, and only bulky uterus wall was written in this report, in the next report. She also came to me in the next visit and with her ultrasound, and it was perfectly normal. There was only presence of two calculi in the right kidney, but uterus was grossly appears normal. There was no such fibroids in the report with arnica 3x and hypericum 1m as an intercurrent remedy. Now, as I already told you that we should approach our patient in such cases with the integrative approach. So we should also advise our patient regarding their diet. I have already told you that the fibroids are mainly influenced by hormones like estrogen, mainly estrogen. So we should ask the patient, advise the patient to add fibers in their diet because it helps the body to get rid of that excess estrogens. So with the medicines, we should advise the patient regarding their diet. Good sources of fiber can be dark leafy green vegetables. Broccoli, you can advise your patient. Chia seeds, they can take. Beans, ground flax seeds, etc. You can ask the patient to increase the intake of soya in their diet because it has anti-estrogenic effects, where in condition where endogenous estrogens are high. So you can advise the patient to take soya in their diet. It might reduce the fibroid risk, or it may help to dissolve that fibroid, or at least it may help to uh, maintain that not the patient can also the size can be maintained, and we can reduce it with our remedies. Then we can advise the patient to avoid white refined grains. The good choices of whole grains can be advised, like brown rice, millet, spelt, buckwheat, rye, oats. And we can ask the patient to avoid anti-nutrients. We can ask the patient to avoid excessive salt, excessive sugar intake, and to avoid saturated fats, caffeine, coffee, tea should be avoided, junk foods should be avoided, and we should ask the patient to strictly avoid alcohol because all this may contribute to estrogen dominance, and it can increase the risk of fibroid formation, or it can interfere with your treatment, and you can struggle while treating your patient. Then you can ask the patient to avoid red meat because it is linked with a higher risk of fibroids. And you can ask the patient to have a diet which is rich in legumes, green vegetables, fruits, which have a protective effect towards from developing fibroids. So this is all about the presentations, and I can also I also advise my patient to go for pelvic exercises during the treatment. We can ask the patient to be more involved in yoga and go for yoga, and they can try that butterfly pose. They can do squats, they can do stretching, jogging for 45 minutes. It will also help the patient to recover early. And you can advise the patient to go for forward bending and cycling in lying position. So you can advise a patient for to involve to into more physical activity, and to have to do some pelvic exercises. The main idea is to reduce the lower abdominal fat, which can help the patient to recover easily in fibroid cases. I have also found that in mostly in the fibroid patients, they are vitamin D deficient, and it there are many research papers which says that it is one of the major risk factors nowadays. Vitamin D, so we have to maintain, if the patient is vitamin D deficient, we should advise them to take supplements, and because vitamin D is have anti-tumor activities in it. So it can also help you to recover your patient in a better way. So this is all from my side. Thank you so much.
Thank you so much, Doctor. Participants, if you have any question, please raise your hand and ask question to Dr. Shweta regarding the subject. Okay. Dr. Ram Parvesha. Where are you? I couldn't. Okay. I will unmute. Okay, now you can unmute yourself.
Thank you, Dr. Anjani, and congratulations, Dr. SHWETA Singh.
Thank you so much.
Very good presentation, excellent session.
Thank you so much.
Gynecological disease, plant fibroid, tumor, select remedy, very good, metformin. First case, metformin, due to suppression of anger suppression, metformin is a very good remedy.
Yes.
Very nice presentation.
Thank you so
Very,
much.
very thanks. Very, very thanks.
Thank you.
But making, emotional causes, fibroid, emotional causes, electrical disturbance after hormonal disturbance of mental disturbance, then cause of disease, any disease. It is name of, according to law of homeopathic science, main cause of mental symptom is a very important symptom. Anger, grief, greedy, etc. Very, very thanks. बहुत अच्छा.
Thank you so much, sir.
Thank you so much, Dr. Ram Parvesha. And if anyone have questions, you can put your questions in the chat box also. And as you told, most of the fibroid cases have vitamin D deficiency, and to correct the for correcting the postures and that is actually I'm appreciating you for giving all the all this Selvi Postaku. She's doctor. Please ask your question.
Thank you very much. Thank you, Dr. Singh. It's very, very wonderful case. And I want to learn something. You give after natrium muriaticum first dose, rubrum metallicum, but everything is going to much better. Why did you change the remedy? Can I learn? Thank you so much.
Thank you, ma'am. Rubrum metallicum is basically placebo.
Oh.
I have not changed my remedy. Yeah, I gave a single dose of natrium 200 monthly basis, and rubrum met is basically placebo.
Okay, placebo. Okay, thank you so much.
Thank you.
Thank you, Dr. Shelvi Postaglu. And anyone else? Oh, please ask.
Thank you very much, madam. It is very educative webinar, and madam is in Delhi, so it is near to me, Aligarh. Inshallah, we hope to see you. Thank you very much.
Thank you.
Thank you.
Thank you so much.
Thank you, Dr. Ahmad Hassan and Dr. Raman. And not only the treatment, yoga, food, supplements, everything together, that will work actually.
Yes, our government is basically, initiative and promoting integrative therapy. So we should also ask our patient to take care of their diet and their physical activity, which is the most matlab, key part of, treatment. So, and we are selecting right remedy, but if the patient is not following the right diet and if they are not following, they are not doing any physical activity, so it you may not get the proper results from them. So we
Yeah.
should ask our patient, advise our patient, or force our patient to do the necessary things.
Yeah, when I was attending one other I mean yoga seminar, that they are telling we are missing some postures now. Before we are sitting and making chapati and cleaning the floor. That will produce more female hormones and to be like a female. Now we are standing and doing everything. No,
Yes,
so
you're absolutely right. We are missing that pressure which we while moving or everything, that pressure that is required for the movement of pelvic for the lower abdomen, that is not there nowadays. We are
Dr.
we
Rema Devi
have
Ambadi has
to-
raised a hand.
yeah.
She will ask question. Doctor,
Okay.
please.
Dr. Shweta Singh, very nice presentation.
Thank you so much, ma'am.
This is the first time I am hearing that 1% of uterine fibroid will be out of uterine cavity. This is the first time I am hearing it. Then the second thing, the rubrum met, very nice. Even we also can write like that. If we are writing SL and PL, our pharmacist and everybody will know it. But now we can use it, rubrum met. And the third thing is, you got the medicine calcarea carb, no, by repetizing. But you again scrutinize the case and you compare you compare the case with the Metamedica, and you came to the Natramur, which has got only 18 marks, and it was very nice. But usually we don't have that much courage. We will we will be in a doubt to whether we have to give it or not. Anyhow, you had done a very good job. Thank you, Shweta. Come again and keep it up.
Thank you
Okay.
so much, ma'am.
Thank you, Dr. Ramadevi. And Dr. Shweta, you have some questions in the chat box. Dr. Raman is asking if endometriosis 16 thickness with regular heavy flow due to emotional problems, please suggest some view.
Dr. Aman, we need symptoms. Without symptoms, I can't comment what remedy to be given. So we should have that. I already discussed what Dr. Henneman said. We have to take proper history from the female. We have to ask how's the menstrual flow, what is her mental state, what are their physical generals, and on the basis of that totality, which can help you to differentiate one person to another, one patient from another, that can help you to diagnose your remedy for the remedial diagnosis.
Thank you. Dr. Danesh, please.
Yes. Good evening, all, and Dr. Seda. It is really a very good session,
Thank you.
and not only that, there is a homeopathic aspect need to be promoted, but the classic method also you mentioned here, and how beautifully homeopathy works in those conditions. The most important point you raised here is the keeping evidence of all these things. Nowadays most of the doctors are keeping all the records with them, but unfortunately they are not uploading the same to the YouTube or somewhere else, so that more and more people know about that scope of homeopathy in fibroids. So since we are a group, we are promoting homeopathy here. We are uploading all those things every next day itself, so that more and more people can reach here. The one who just speak to you was Dr. Remadevi Ambadi. She has more than 2,000 successful cases of infertility with her. and she is having lot of fibroid case cured with homeopathy also. So a lot of the scope of homeopathy in this field is very, very bright now, but we need to go to the public and show them that we are doing these things. Anyway, congratulations for your
Thank you so much.
excellent session. We can have some more presentation in the future. With
Sure.
thank you.
Thank you.
Thank you. We have 1 minute. Dr. Ramadevi Ambadi, please say vote of thanks to Dr. Shweta.
Shweta, it was very nice presentation, and you had worked a lot, it seems. Then we are expecting more and more, not only about fibroid, other gynecological cases also we expect. Okay. And there is very good chance in this infertility see, for homeopathy can do wonders. We had been myself and my friend Dr. Chanda had proved it. See, in here doctors will be telling you won't get children. You have to adopt, or you have to adopt surrogated uterus or surrogated mother. Then for them also we have got issue children. And thank you a lot. Homeopathy can do wonders. You youngsters should do like that.
Thank you
Our
so much,
time is
ma'am.
over, no?
Thank you so much, Dr. Ramadevi
Anyhow,
Ambadi.
I say my thanks on behalf of me as well as on behalf of the IFPH. I can show my gratitude to you. And
Thank you
please
so
come
much.
again and
Thank
again.
you.
Okay.
Thank you so much. Now we are continuing our session as Malayalam session, and I'm handing over the session to Dr. P. Shaila. I'm inviting Dr. P. Shaila for moderating Malayalam session. Doctor, you are welcome. Please.